introduction. Good afternoon to everybody. So now let's jump from science to technology, and I will try to follow this agenda. I will try to give you a definition of the isolators and their use, the business unit of Synthetica, the requirements for stem cell manipulation, and the development of isolator that could meet these requirements. And at the very end, the Celli isolator, this is the result of this project. So let's start with isolator. Isolator, you can see, as Professor Simoni said, is a box. A stainless steel box with a window and gloves. The important thing of isolator is that it's a separative enclosure. That means operator can manipulate products into the isolator only through gloves. The environment into the isolator is decontaminated, and the air can enter the isolator only through microbial retentive filters. Therefore, if you want to put into the isolator material or come out from the isolator material, you should use special airlock that has to be decontaminated or rapid transfer port. That means that isolator provides a high level of sterility assurance, preventing the contamination from the outside into the inside of the isolator, and both maintaining, if contamination occurs inside, the contamination into the isolator, preserving the operators and the environment. For those two reasons, isolator technology is very well established technology and started this first in the nuclear industry in the 60s for the property of preventing contamination from the isolator to the outside, the environment and the operators. Then in the 90s, moved to the pharmaceutical industry in order to upgrade the sterility assurance level and the protection of the operator from potent compound and toxic products. Then he moved to active pharmaceutical ingredient manufacturing, hospital pharmacies, for example, when there is anti-cancer products manipulations, and research and development in biomedical laboratories, for example, for animal care, rodents for testings, and so on. So this large variety of isolator, Synthetica started this isolator business unit in 2000. Synthetica is much older. It's a Swiss pharmaceutical company founded in 1921. I was not there at that time. And we are doing a large variety of isolator for different sectors of industry. The majority of those are related to the aseptic manufacturing in pharmaceuticals, powder handling, and hospitals, pharmacy, where a lot of particular manipulation of potent compound and toxic agents are done. And the last development of isolator is the stem cell manipulation. We have a lot of customers worldwide, and just to give you an idea, a machine like this could have a cost of around $1 million. So, what we did, in order to understand how to well develop the isolator for stem cells, we formed a joint team between BioCell Center, the specialist of stem cells, and Synthetica. And this joint team was comprising a lot of people, microbiologists, research and development scientists, stem cell specialists, validation, process engineers, quality controller, and also top management was included due to the criticity of the project. So what we did at the very end, as Professor Simoni showed, we want to start from a sample of 3 cc of amniotic liquid fluid containing stem cells, and we want to have at the end a vial containing the stem cells to be cryopreserved. All this process has to be done in the safest way for the cells and for the operators too. So those were defined as major requirements for this isolator. First of all, aseptic manipulation. Then we have to avoid microbial contamination and non-viable contamination, particulate matter. We need to avoid mix-up we need to have a total traceability of the operation done on the cells, and we need also to have an ergonomic process. I will show you why. So, I will go through each of those requirements in order to show you which was the approach and the solution proposed. First of all, aseptic manipulation. That's critical because if the isolator is not well designed and the operator must do mismanipulation, it can occur that damages can be generated on the stem cells. So, what we decide to do, to have a mini isolator, very compact isolator, its length is less than 5 feet, and instead of building a big clean room, where the risk of mismanipulation is much higher because you cannot standardize so well the procedure as with the isolator can do. So, firstly, the isolator is composed by 2 cabinets. The first one is an airlock, where you can load the biological material, all the things you need to do the operation. And the second is a cabinet, where you perform the manipulation. So, we have defined that the isolator is closed, as I told you, to upgrade at the maximum level the sterility assurance of the process. Then we have developed the isolator divided in 2 rooms, as I show you, an airlock and a working cabinet. And we have developed a biodecontamination cycles before and after each sample manipulation. The entire of the cabinet has the same classification of an aseptic manufacturing filling facility, pharmaceutical one, ISO class 5, former federal standard in US 100. And the important thing that the air during the exposure of the sample is filtered through absolute filters, and there is a laminar airflow that maintains the purity and the sterility of the air by recirculating more than 800 times per hour the volume of the cabinet. Again, all the material used to perform the manipulation are sterile and disposable. So let's concentrate on the big issue, avoiding microbial contamination. FDA, in the current good tissue practice, says with each possible measure in order to prevent introduction, diffusion, spread of contamination must be put in place. So, contamination is defined as communicable disease agents. So in order to do that, nice ringing. One answer. It's called contamination. No way. So what we did, we developed an integrated generator or hydrogen peroxide vapor state in order to do the sterilization of the surface of the isolator and of the external surface of all material incoming into the isolator. And then, as I told you before, all air coming into the isolator is filtered with absolute filter twice. So, just to focus a little bit more, the contamination is it's a good issue, yeah? Yeah, sounds good. So, just to point out which way we do this decontamination process, that it's really critical. We switch off the phone normally during operations. No, I'm joking. So the vaporized hydrogen peroxide at low temperature is capable to destroy exposed bacteria, viruses, including HIV and the bovine spongiform encephalopathy and fungi. This is very important. Those are defined in